All right, I'm Dr. Michael Miyazaki, and I'm excited to present to you some information about how to better submit your cases to have quality, well-fitting Perio Protect trays fabricated. But one of the things that we're going to really focus on during this program is intraoral scans, because in many offices, the intraoral scans may be done by the assistant or maybe even the hygienist. And so I think it's always important that all the team members understand what it is that we're looking for. If we do this, we do have that well-fitting tray that will push the gel into the sulcus, and that's what we want. We want this tray to fit snugly around the teeth so that that gel is put into the deep areas of the sulcus. So here's an intraoral scan that's a very nice one. We have all the tooth surfaces you can see on the facial, on the buccal, on the lingual, all the occlusal surfaces, the incisal surfaces. We have everything very nicely defined. We go about 4 millimeters beyond that gingival margin, and there's no voids. You don't see voids in those models. And for those of you that may have not have seen how these scans work, is there's a camera that we rotate throughout the patient's mouth, and we see the image come up on the screen. Now, if there's any voids, those are kind of the clear areas where it looks like we're looking through the teeth. And that's just where the camera, at the angle that I had the camera positioned, wasn't able to get into what we call the undercuts. And so we just have to turn the model, rotate it on the screen. As we rotate on the screen, we look for those areas where we have the voids, and wherever we had the voids, like here on the distal buccals of those molars, we just go back in with the camera and we just rescan those areas. It's nothing very difficult. And what we don't want to do is we don't want to leave voids. So if we have voids like we see here on the backs of these models, there's no way the laboratory is going to be able to figure out where the teeth meet with the soft tissue back there. And if they guess, the patient's not going to probably be able to seat the tray down. We're not going to have a good fit. So in this case, the laboratory is going to have to call you back and say, hey, can you get the patient back and rescan, because there's areas of this intraoral scan where we're missing information. You look at this scan. This is a top arch and a mandibular arch, so maxillomandibular, and you think, well, the scan looks pretty good. We have all the teeth surfaces in there, but I want you to think about what you would do with this scan. Do we have everything that you want?
Well, what we don't have is we don't have the 4 millimeters beyond the gingival margin on the upper left cuspid. We barely even see the gingival margin. So we want to add to these scans and get a little more. This is a stone cast, and what I did was I marked points 4 millimeters away from the gingival margin, and this red line kind of traces out those points. So that's the 4 millimeters of distance we want to be away from that gingival margin area.
And so I want you to just kind of put that in your mind. So again, here's just some tips. As you get into your scanning, if the patient's teeth are really wet and moist, then what you might do is just take a little bit of air and just dry the teeth gently. Again, that'll make it so the teeth are not as shiny. That'll make it easier for the camera to capture the contours of the teeth. Another tip is if you've got a lot of food or debris or plaque in between the teeth, is go ahead, see we got a little food there, go ahead and floss. That floss will remove that food. We don't want to scan that. That's going to create discrepancy in our intraoral scan. Sometimes it's hard to get the buccals of the teeth because the patient's mouth is wide open. They're trying to help us out. So if I have the patient closed just halfway, now I can get into that buccal area of those most distal molars. So again, have the patient just close down halfway. Now here is, again, what the good scans would look like. We've got good occlusal surfaces, buccal, facial, lingual areas.
We've got 4 millimeters of the soft tissue from the gingival margin all the way around.
Kind of what we should be focused on. We want to have good, clean, complete, accurate scans
with 4 millimeters of soft tissue beyond the gingival margin.
So the Perio Protect trays are a way that we can offer our patients a minimally invasive procedure to improve their oral health. So thank you very much for watching this program. I hope it helps to increase your understanding of what's required to get good fitting trays back from the laboratory. So thank you very much for watching the program, and I wish you the best of luck.